Here we are with Suzette, and we are done treating her for the day. I'd like to start with, first of all, how I assessed her. There's a few things I look at when I first meet a patient, and that is the bony structure, first of all. Is it intact? Is there any bone loss occurring? The skin, is there much laxity? And is there any fat or tissue loss? And we know now, more than we did in the past, that different people age at different rates and different parts of the face age at different rates. And with Suzette, her bony skeleton is very intact, and she has skin that is holding up her fat centrally, but she does, and she was, having some peripheral fat loss starting from her temporal regions to the periauricular region and some on the jawline. Now her mid-face is beautifully intact. There is probably some bony loss happening in the nasojugal fold, and we did correct that. But in the mid-face and lateral cheeks, there wasn't much loss, and she's holding on to that bony region, and the fat seems to be intact in that area. So we started with treating her in the temporal region with Radiesse. We treated her orbital region superiorly and bilaterally with some Belotero to give her some lift. And the jawline, we used some Juvederm to correct the dimpling that was occurring, as well as the chin area. We also added some Botox to her masseters, which we thought were developing. I also added some Botox around the eyes today. And we have done Botox in the past on her forehead and the glabella region, which are fine today. So looking at it overall, I think she'll see her complete results in a couple of weeks and see if we need to really add anything more. And I think what is surprising to a lot of people is that we actually have used almost 6 syringes of product on her. And when you correct things properly and you inject deeply and you assess patients correctly and place fillers therefore in the appropriate places, you don't get that puffed out look, and you don't need to if you correct it appropriately. And we'll see her back in 2 weeks and see how she's doing.